Hey everybody, welcome to Ask Dr. Testosterone, starring Dr. George N. Tuliatos and brought to you by his book, The Bible of Bodybuilding 2. Over 700 pages packed with everything you need to know about training, nutrition, supplementation, PEDs. So much great info in there. You can get that on Amazon.com. While you're on Amazon buying books, get Real Bodybuilding by Ron Harris, also an amazing book. And now all the way from Athens, Greece, where it's very, very hot today, please welcome Dr. George Tuliatos. Hey, Doc. What's up, man?
What's up, Ron? It's 100 degrees over here.
Ooh, goodness gracious. So this is baby Nicole's first Greek summer. So you must
went to the beach and we had fun.
So I assume you keep her out of the sun, right? Yeah, man. But okay, we got some great questions. I wanted to start off with a question because over the years, I've always kind of used Deca and equipoise interchangeably. I always thought they were kind of the same as far as effects on me. I know some people prefer one over the other, but that leads us to our first question this week. Someone asked, since EQ, which is short for equipoise, has the capacity to generate 2 to 3 times more collagen synthesis than nandrolone, is there a solid case to be made for low dose, for example, 100 milligram per week use over nandrolone in TRT type protocols? Increase in red blood cell count aside?
Now, as far as I know, the most notorious steroid for collagen production is testosterone.
Okay.
I never heard anything about equipoise. Equipoise is notorious for boosting the hematocrit and the appetite.
Yeah.
And Deca is supposed to relieve and smooth the joint ache through the synovial fluid, the aldosterone kick that flushes water, so it retains sodium and water, and then it lubricates the joints. So I believe that, Deca can smooth the joints, but this could be tricky then if you load it with more weight, and because perhaps you're going to rupture some tendons. Besides, using too much anabolic steroids will strengthen muscles and other tendons without the GH, and then you have a tendon rupture.
Yeah.
So only whistle, I know that it's good for collagen and bend. That's why whistle is very good, effective for burns, because collagen stimulates healing in the skin, and the wounds then close and heal up much better. And Milos knows about that because he was administered Winstrol and Anavar when he was hospitalized for this.
Oh, that's right.
So I believe the answer here is Winstrol, but Winstrol, on the other hand, is very nasty for the lipids and for the liver. So you need therapeutic doses. You need 10 milligrams, not 50 or 100.
Wow.
That they give to the horses.
Yeah, I mean, equipoise, as people should know, was not developed. It's not made for humans. It was made for horses.
It's very good for cattle to start grow again, and after when cattle are injured, or they are sick, then they need to speed up the appetite.
Yeah,
and they use them for cows,
Right. Yeah, so that's the major benefit that I always heard and experienced myself with equipoise. For people that have very low appetite and have a hard time eating enough food, it stimulates. And now they use like peptides like GHRP, whatever the hell it is.
Yeah. And the ghrelin agonist, yes, the GHRP6, sermorelin, your appetite.
Yeah, but I've never, we've been both around the anabolic world, anabolics for a very long time, and I've never heard anything about collagen synthesis being a benefit of equipoise. So
yeah, true.
I don't even know if that's true. I was just taking this guy at face value.
If you Google it says stenozolol is effective to stimulate collagen.
But
that's why
that hurts your joints, Winstrol.
Yeah, that's the other point. So when you have an open wound, you can give Winstrol, but not when you have arthritis.
Okay. All right. This is a great question. Doctor, a year ago, I graduated nutrition here in Brazil. The market is very difficult. And when you have a beautiful physique, it helps to sell your work as if it were a business card. I would like some advice from you. How much is it worth sacrificing your health to build a beautiful body to increase my patient intake? Currently, I only do TRT. As I know that a beautiful physique takes years to build. I've been training for 20 years. What would you recommend taking in the long term drugs and doses so that I can maintain my health and improve my physique to have more patience. I'm also a power lifter.
Yes, listen, if you're a power lifter, then obviously this is not about health because you push yourself to the limit and you live like a horse to lift heavy.
Yeah.
And you need to be big, and bigger is not healthier. Small dogs live longer. Powerlifting is very extreme as much as bodybuilding, and some people have nose bleeding while they lift. They get strokes, they pass out, they faint. I've seen people squat 1,000 pounds and then they have a huge ventilator in front of them ready to faint, pass out. It's horrible. Come on.
Oof.
And you need at least 1 gram of testosterone to lift 1,000 pounds, Anyway, just stick on testosterone because it's the healthiest term you can use.
Yeah.
You can live healthy and you can boost your vitality and your longevity with testosterone, but optimal doses. And nothing else. I mean, Deca is the #1 steroid that is being used to medicine, but occasionally for a short brief period of time. Okay. So if you want to have a good body, diet is #1, and you have to be to a certain body weight according to your diet and your training so far that keeps you low in body fat. For me, it's 200 pounds. For you, maybe it's 205. Yeah. For somebody else, it's 190. For somebody else, it's 250. No. So I believe the diet is a key number to get rid of your body fat, and then just cruise with testosterone.
So George, his question made me wonder about you because, you have one of the best physiques of any medical doctor, I think, in the world. Probably. Let's be real.
When we started the show in 2019, I was 220. I didn't have my abs visible. Then at 200, I have, even though I'm using the same stuff.
Yeah.
Test GH, Proviron, DHA, a bit of Deca occasionally.
Yeah.
But when people now challenge me, I get rid of this bloody blanket that I had of 20 pounds, and here I am now. I do the same training. The diet is different. I do the same HRT. So diet is a key factor.
Yeah. But my question is, do you think because you have an outstanding physique, especially compared to other medical doctors, do you think it's helped your career in any way as a doctor, or it's just totally separate?
Of course. Okay.
Okay.
You bring with more patients, more clients, more customers.
Okay.
Because you walk. It's like somebody who wants to train people, and having a six-pack is more appealing. The point is, you may have an Olympic coach of weightlifting who won a gold medal back in, let's say, in the Olympics 30 years ago. He doesn't have to be with a six-pack now.
Right.
It's the knowledge. But the point is, you sell more with your looks. Okay.
It's true.
Same goes for the cardiologist who smokes and tells you stop smoke. Okay. Or an endocrinologist who tells you lose weight when he has a belly button. So.
Yeah. We have a lot of those here in the U.S. So let's move on to the next question. I'm trying to dial in my hormones with my doctor, but fighting through surgeries and injuries, and I'm on pain management meds. I'm on 200 milligrams test sip a week and Estradiol, 0.5 milligram, 2 times a week. There's days I feel like a bull, and others I will crumble into pieces. Hopefully increased activity and diet will level out how I feel. Would Deca always respond well with decreased joint pain? Any suggestions?
Yes, Deca can help you with that. All right, but too much of Deca will make you look puffy. All right, so you got to be very, very careful with your diet, with your sodium intake, with your carbs. Follow a cutting phase diet while you use Deca because you may blow. Yes, and it certainly does. It's very effective for this to smooth the joints, the knee, the elbows, the shoulders.
What's a good therapeutic dose? I think you were using 50 milligrams a week, something like that.
50 milligrams, yes.
Yeah.
Continuously, yes, it will accumulate. For you, I think it's 100, right?
Yeah, I'm on 100 a week. So I figured out, I did the math. I'm on 240 milligrams of test sip a week because it's 0.7 every 4 days. I did the math. So it's 240 milligrams a week. Lowest I've ever been on in my life. Well,
Did you ever stop the Deca for a brief period of time?
Well, I'm going to run out soon, and I'm probably not going to get a refill for like a month. So I'll probably be off it for a month, not even intentionally. Just
let me know if your muscles are less full, if your joints ache. Let me know about your thoughts just before using it again, okay?
Okay. All right. This is a long one. I'm surprised you didn't say no to this one because we don't like, generally speaking, guys, try to keep your questions short. Try to get to the point as quickly as you can. So here we go. In the last year, I've had a lot of stress with my businesses, and I noticed that my free testosterone was low and my prolactin was high, around 30. I also can't sleep well and had more tests done, and TSH was 5.8. After 3 months with Erythrox, 25 milligrams every day, and Dostonex, half a tablet a week for 4 weeks, and then every other week, half a tablet, TSH became 4.9, but prolactin was around 30, and my FT was again low. My endocrinologist prescribed me another 3 months of Erythrox and Dostonex. We decided that I should start TRT therapy because we've been trying for a year to get my testosterone back up, but it's not working, even with your protocols. I'm 33 years old, former athlete, and since my teenage years, I've had medical tests every year and always TT, FT, LH, FSH, SHBG, TSH, etc. were normal. Can you tell me what you think and what you would do in this situation?
Yeah, I mean, TSH needs to go down because it's 5 point 4 point something. You need to bring it down. Perhaps you need to increase your T4. I would try selenium extra also.
Okay.
What was the rest?
So this TSH was low. So he's back on Erythrox and Dostonex. He wants to know if he should start TRT therapy because his test levels never came back up.
We need to know how much the total testosterone, the free, even though we don't treat exclusively numbers, we need to have a guideline here, okay, to direct us.
Yeah, because his initial concern was his free test was low, his prolactin was high. So I guess all these protocols.
Yeah, low prolactin, of course, it helps with testosterone, but not exclusively, no.
Gotcha. All right. Next question is, I just added 150 milligrams a week of NPP injections every other day to my TRT protocol of 175 milligrams a week of testosterone and nandrolone injections every other day. Will NPP, and that stands for nandrolone phenylpropionate, guys, raise my estradiol? It was at 62 before starting NPP. Total testosterone was at 928. Does Dr. T recommend to stay in a certain estradiol range? I know this is a very controversial subject, but some doctors like Rand McLean suggest to stay in the 15 to 20 range.
Yeah, I've said before that E2 has to be proportional with the total T and the free T, of course, the one that aromatized because it's bioactive for it. So to me, it's more reasonable to have 1100 total testosterone with 110 estradiol, okay?
Okay.
And we have to be guided mainly by the symptoms. Now, if you refer to a total testosterone of 800, then you can say that 80 is reasonable, but some other people believe that should be 5% of the total testosterone. So let's say could be 40. Now, Rand, I think 15 to 20, it could be really low. Certainly, you need the aromatase inhibitor to keep it that low.
Yeah.
And it's controversial. I mean, it's not a direct opinion yet. Some people blame the estrogens for a blood clot. Some people say it's the synthetic estrogens in the contraceptive pills that do the blood clot. Some people say that estrogens are bad for the cardiovascular disease. Like others say that it's beneficial for the endothelium. Others say estrogens are good for the mood, for the sex drive. Others blame estrogens for the prostatic cancer. You know, we don't have a certain guideline that everybody approves.
Right.
But we need to optimize all the hormones. And Morgenthaler also supports this. Everything has to be in a balance, you know, like an orchestra.
Yep. Does nandrolone in general raise your estradiol?
Sorry?
Does nandrolone, generally speaking, raise your estradiol levels?
It aromatizes, but to a lesser degree than testosterone.
Okay.
So NPP, because it clears the system faster, is less likely to aromatize like the propionate testosterone, you know?
Right.
Aromatizes, but it's more likely to be out of the system, so no issues are yet formed anymore.
Gotcha.
Okay.
Okay. Next one is, in 5 weeks, I'm finishing my cycle of test 300 milligrams and Winstrol 50 milligrams a day on a calorie deficit. I'll do 2 months after PCT, a bulking cycle with 400 test and 200 Deca. Since I will do another cycle, is it worth doing another PCT or going cold turkey? So he's going to be 2 months between cycles there.
How long is between cycles?
So I don't know how long he's been on this cycle, but he's gonna give himself 2 months between cycles. He's doing a cutting cycle now, and then he's gonna take 2 months off and then do a bulking cycle.
Yeah, 2 months off. Some people say just cruise with testosterone, a small dose. Yeah. Because listen, it's stupid to go to PCT and then right after go and suppress your own testosterone with another cycle. Follow PCT, but let your system recover. Otherwise, for 2 months, for what?
Yeah.
And besides, with the PCT, even if it's effective, you're gonna perhaps save your sex drive by gonna miss your gains. You're gonna become smoother,
Fair enough.
So I guess use a low dose of testosterone between, like a bridge, let's say, because you need to grow then, and you're gonna start from a different level rather than from lower.
Okay, fair enough. More questions about aromatizing. When someone is on TRT and he is a high converter in estrogens, TRT dose 150 milligrams per week, including 1 Arimidex plus 1,000 milligrams HCG with E2 up to 110, even with the Arimidex. What can he do? Would the cream be helpful instead of the shot?
Yeah, the cream help because they don't spike. They don't spike in the style. You use a daily dose, okay?
Okay.
I guess then also you can do microdosing of the testosterone. Now, microdosing it's preferable only with the propionate. Otherwise, if you have the enanthate, you need to do at least twice a week. The most you need to do twice a week. Yeah. Otherwise, it's not beneficial, okay?
There's no point. So long acting.
Yeah, and then you can use other agents like Novodex for the vagina or DIM and high dose of zinc that have an estrogenic activity. Avoid alcohol also that aromatizes.
Yep. Okay. Our final question is a woman for women from women. Why do women gain fat in the upper back? And is there a way to prevent this? I have low body fat percentage and slim everywhere except upper back. Could it be some kind of lipoma or fatty deposit? And how would I know?
Why some people have fat deposits, like fat storage? Yeah. I think it has to do with the receptors, the androgenic receptors. Now, clenbuterol works to the androgenic receptors. Ephedrine also to the androgenic receptors that release catecholamines, meaning adrenaline or epinephrine. So some people accumulate less fat in the love handles because they have more androgenic receptors and they respond much better to the fat burners. It's all genetics,
Yeah. Yeah, because I mean, most women, they carry their fat in the lower body, like the hips, the butt, the thighs. We've all seen women with normal size upper bodies where if you only saw them from the waist up, you'd think they were slim, but then the lower body's very, very overweight.
About the diet, they seem to eat a lot of carbs.
They love bread. They love bread.
Yeah, pasta, rice, and they seem to be less physically active.
Yeah, but in the case of someone with a very specific fat deposit area, I think sometimes it is lipoma because I've seen people with like big humps. It's like a big lump of fat just out of nowhere. It's awful.
And also, apart from the subcutaneous fat, there is also fat into the muscle that's more stubborn to get rid of.
Yeah. Well, that's all our questions for this week, guys. Reminder again: go on Amazon.com and pick up your copy and educate yourself. Everything you need to know. It's all in there, guys. I swear if you read this, you're going to be so much smarter when it comes to all these topics. Dr. Toulianos, we're very, very lucky to have you every week here, guys. Only show on YouTube, a medical doctor who's also a champion bodybuilder answering your questions that your personal physician probably has no idea. and you don't want to get these questions from some gym bro who doesn't have any medical background. So thank you so much, Doctor. Appreciate you. And guys, if you like what you see on Ask Dr. T and the other things on this channel, please subscribe, like, share, and ring that bell. And that's it. For Dr. Tuliatos and myself, thanks for watching another episode of Ask Dr. Testosterone.